So the approach that we use here is called the Ponseti method. It started in Iowa several decades ago, but unfortunately it wasn't popular until early 2000s in the whole country. So what makes the Ponseti method different than what we used to do mostly in the United States before 2000 is, if you look at 1990s and 1980s, mostly these kids were treated with big surgery, which is called a post-medial release around age 1. There were a lot of complications associated with surgery: overcorrection, undercorrection. Usually the foot looked okay, but a lot of them end up having painful arthritic feet as adults. The good thing with the Ponseti method is minimally invasive. You don't, there's no big surgery performed with it. It uses the flexibility of the tissues at an early age to correct the deformity with casting followed by bracing. So if long-term studies have shown that the adults who've had their feet treated with this Ponseti method in childhood, they do really well, and they're able actually to participate in almost all of the activities of daily living and sporting activities without any restrictions or limitations. So that's actually one thing that we talk to parents about is if we follow through this method, it's cumbersome, it takes a lot of appointments, take patience, but the ultimate result is, your child will end up with was actually expected to end up with a painless foot that is as functional as a foot that did not have any deformities to form with.